Hello and welcome to our special session on the basics of Medicare. I'm Niki Trentacosta, your guide and expert at the Tanna Group. Whether you're nearing 65 or already celebrated your 65th birthday, understanding Medicare is crucial for your healthcare journey. Today, we're diving into the essentials of Medicare, breaking down its complexities to make your choices clearer and more manageable. Our journey today is not just about facts. It's about empowering you to make the best healthcare decision for your future. Let's start with a little bit about us. At the Tanna Group, we stand at the forefront of healthcare consulting with a focus on Medicare. Our journey began with a simple vision to demystify the complexities of health insurance. For over 15 years, we've been guiding individuals like you through the maze of healthcare. Our approach is personal, our expertise is deep, and our commitment is unwavering. We don't just offer advice, we build lasting relationships to support you at every step of your healthcare journey. What drives us at the Tanna Group? Two things, our vision and our mission. Our vision is a world where healthcare decisions are clear and accessible. We strive to turn the often confusing world of Medicare into a path for your health and well-being. Our mission is simple yet profound, to provide you with understandable, tailored healthcare options. We believe in encouraging you with knowledge, equipping you to make informed decisions about your Medicare coverage. Now, let's talk about Medicare. It is a government-run health insurance program. Specifically, the Department of Health and Human Services oversees the Centers for Medicare and Medicaid Services, or CMS. It's primarily for people aged 65 or older, but is available to younger people with individuals like certain disabilities and people with end-stage renal disease. Generally, if you're 65 or older, you're eligible for Medicare. Now, enrollment is key. Your initial enrollment period begins 3 months before you turn 65 and ends 3 months after your 65th birthday. Enrolling during this 7-month window is vital to avoid late penalties and ensure your coverage starts when you need it. That's called your initial enrollment period. Additionally, there are things called special enrollment periods, or SEP, and those are based on many different scenarios throughout the year. Understanding Medicare can sometimes seem like learning a new language. So to help us navigate our journey, let's clarify some key terms that you'll often encounter. These 7 terms are essential to grasp as they form the foundation of your Medicare knowledge. We discussed enrollment eligibility on the last slide. Next is government versus private. This refers to who manages the claims. Original Medicare Parts A and B are run by the federal government, and Medicare Advantage and prescription drug plans, as well as Medigap policies, are offered by private insurance companies, but are regulated by CMS. Inpatient and outpatient describes the type of care you receive. Inpatient care involves an overnight stay in the hospital, while outpatient care includes services where you're not admitted to the hospital, such as doctor visits, scans, same-day surgeries, or even emergency room visits. The term network is fundamental for Medicare Advantage plans. A network is a list of doctors or hospitals and other healthcare providers that your plan has contracted with for medical care. There are different types of networks, including HMO and PPO options available. Moving on to the financial part of definitions, the deductible is the amount you pay out of pocket for your health care before your insurance starts to pay. It's a set figure that you need to meet each year. Coinsurance is your share of costs for any covered services. It's usually a percentage, and it kicks in after you've paid your deductible. Finally, out-of-pocket maximum. This is the most that you must pay for covered services in any plan year. After reaching this limit, your plan pays 100% of covered services. Understanding these terms will help you better understand the specifics of your Medicare plan and help you make more informed decisions about your health care. Remember, the right knowledge is powerful and is a tool in managing your health and well-being. Now, let's begin our journey into the parts of Medicare. We'll begin with Medicare Part A, commonly known as hospital insurance. Part A is a fundamental part of Medicare, and it covers your inpatient care. What does this mean for you? Well, if you need to stay in a hospital, use a skilled nursing facility, require hospice, or any home health services, Medicare Part A is there to help cover these costs. A key point to remember about Part A is for most people, it's premium free. That's right. If you or your spouse have worked or paid Medicare taxes for at least 10 years, you won't have to pay a monthly premium for this coverage. This is a significant benefit as it helps reduce your healthcare costs in retirement. However, there are still some out-of-pocket costs to be aware of. For instance, there is a deductible of $1,632 for each hospital stay. You must understand that this is not an annual deductible, rather it applies to each time that you're admitted into the hospital. And while there's no coinsurance for those first 60 days of any specific stay, extended stays will incur some added costs. The coverage under Part A is quite comprehensive for inpatient services. However, it's not going to cover long-term or assisted living care, so consider planning accordingly. Part A is the base of your Medicare coverage. It's also the starting point for considering added coverage options such as Medicare supplement plans, aka Medigap, or Medicare Advantage plans, aka Part C, which we will discuss later in the presentation. Second, let's discuss Medicare Part B, also known as your medical insurance. This part covers your day-to-day healthcare needs. Part B is designed to help with the costs of services from the doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and even your preventive services. Unlike Part A, most people do pay a monthly premium for Part B through the Social Security account or your wire transfer. The standard monthly premium amount in 2024 is $174.70 per month, but this can vary based on your income level. This concept is known as the Income-Related Monthly Adjustment Amount, or IRMA. In other words, if your income is higher, you might pay more for Part B. Another important aspect of Part B is the annual deductible, which is a measly $240 per year. After you meet the deductible, Medicare typically covers 80% of approved services, and you're responsible for the remaining 20%. This is known as your coinsurance and should be factored into your healthcare budgeting. Note, there's no network for Part B coverage. This means you can visit any doctor or healthcare provider in the United States that wants to process your Medicare claim. This offers a great deal of flexibility, allowing you to choose the providers that best meet your healthcare needs. Understanding Part B is key to effectively managing your outpatient medical expenses. While it covers a wide range of services, remember that it doesn't cover everything. Services like routine vision and dental care, hearing aids, and long-term care are not covered under Part B. It's essential to consider these limitations when you're planning your healthcare. Now, let's look at some options that meet these needs now. Medicare Part D, or prescription drug coverage. This part of Medicare is essential for anyone who needs medication regularly. Unlike Parts A and B, Part D is offered through private insurance companies and is regulated by Medicare. So we're going to put CMS on there just because we know that they regulate this program. Here's what we need to know about Part D. The cost for Part D can vary widely, but on average, the monthly premium is between $1 and $35 a month. This can differ based on the plan you choose, your income level, and even your geographic region. Remember, if your income is higher, you are going to be subject to that Part D IRMA fee. Now, each plan has its own set of deductibles and coinsurance, and they're also going to vary based off of the prescription medications that you need and the specific plan that you select. Also, Part D plans often have preferred pharmacies, which means that you'll get the best rates on medications when you choose these pharmacies. Be sure to check whether your preferred pharmacy is in the plan's network before enrolling. Now for some good news. There are some limits on how much you are subject to pay out of pocket each year for your medications. In 2024, the out-of-pocket maximum is $8,000. But thanks to the Inflation Reduction Act, in 2025, the out-of-pocket cost is going to be capped at $2,000 for prescription drug coverage or Medicare Part D. Finally, just like with other parts of Medicare, you have a specific enrollment period. It's important to enroll in Part D plans when you first become eligible to avoid late enrollment penalties. For example, if you don't sign up for Part D when you're first eligible and don't have other credible coverage, you will face a 1% penalty for every month that you were eligible but didn't enroll. Understanding Part D is pivotal for managing your medication costs. It's all about finding the right balance between premiums, deductibles, and out-of-pocket costs while ensuring your medications are covered. As always, review your Part D coverage annually as plans and medication needs can change. As we navigate further into Medicare, let's discuss Medicare Supplement Insurance, also known as Medigap. These plans are labeled as Parts E through N. Medigap plans are offered by private insurance companies and are regulated by CMS, and they're available to anyone who's enrolled in Medicare Parts A and B. Here's a brief overview of what Medigap covers. Medigap plans help pay for some of the healthcare costs that original Medicare doesn't cover, such as the copayments and coinsurance and deductibles. Like original Medicare, Medigap plans typically don't have a network. So you can use any doctor or hospital that processes Medicare. The different plan letters E through N offer varying levels of coverage and are all standardized by the government. So each plan design is the same, but their price may change between carriers. Plan G is a popular choice as it offers comprehensive coverage, only leaving out the Part B deductible. Premiums for Medigap plans can range between $50 and $400 a month, depending on the plan and where you live. The last part of Medicare that we'll be exploring today is Medicare Part C, also known as Medicare Advantage. This is an alternative to original Medicare and is offered by private insurance companies that have been approved by Medicare. Again, CMS regulates this. Medicare Advantage plans bundle Part A, your hospital, and Part B, your medical insurance, and often include Part D, the prescription drug coverage, as well. This makes it a convenient all-in-one choice. Many Medicare Advantage plans offer extra benefits not covered under original Medicare, such as vision, dental, hearing, and even grocery coverage or additional spending accounts. This can be a significant advantage if these are services that you need or predict needing. One key thing to remember about Medicare Advantage plans is that they usually have a network of doctors and hospitals. This means you may need to see healthcare providers within the plan's network to get the lowest out-of-pocket costs. It's vital to check whether your preferred doctors and hospitals are in a plan's network before enrolling. While many Medicare Advantage plans offer $0 monthly premiums, it's vital to look at other costs like copays, deductibles, and out-of-pocket maximums. These costs can vary widely between plans. Also, you must be in Medicare Parts A and B in order to join a Medicare Advantage plan. You can only join, switch, or drop a Medicare Advantage plans during certain times of the year, typically during the annual enrollment period from October 15th to December 7th. When considering Medicare Advantage, think about your healthcare needs and lifestyle. If you prefer having coordinated care and don't mind having a network of providers, Medicare Advantage might be a suitable choice for you. In summary, Medicare Part C offers a way to receive your Medicare benefits through private insurance plans with added benefits and potentially lower costs and out-of-pocket costs, but there are a few network limitations. It is a great option for those looking for comprehensive coverage and added benefits, as long as you're comfortable with that network restriction. Now that we've explored all of the distinct parts of Medicare, you might be wondering, how do I choose the best option for my needs? This is a crucial question, and the answer is unique to everyone. As we transition into the next part of our presentation, we'll focus on how to select the Medicare plan that aligns with your specific healthcare requirements, lifestyle, and financial situation. Our goal is to equip you with information necessary for you to make an informed decision. It's all about balancing the cost, coverage, and convenience to find a plan that offers you peace of mind and meets your healthcare needs. Remember, there is no one-size-fits-all solution in Medicare. Okay, so let's delve into option 1 for your Medicare choices, which is enrolling in only original Medicare. This means you enroll in Part A, your hospital insurance, which is generally premium free. It has that $1,632 deductible and no coinsurance for the first 60 days. Then you enroll in Part B, which covers your day-to-day medical needs. Most people pay the monthly premium of $174 a month for Part B, and it comes with the $240 annual deductible and the 20% coinsurance on your services. Original Medicare supplies broad coverage, but it does not cap any out-of-pocket expenses. This is a major factor to consider, especially if you have frequent medical needs. In summary, option 1, Original Medicare, offers comprehensive hospital and medical coverage. It is a solid base for your healthcare needs in retirement, especially if you value flexibility and choice in your healthcare providers. Option 2 for your Medicare coverage combines Original Medicare with a prescription drug coverage, or Part D. Let's break down what this option offers. Just like option 1, you enroll in Part A and Part B. But this is where option 2 differs from option 1. You then enroll in a Part D prescription drug coverage plan. This covers your prescription needs and is essential for those who need regular medications. The average cost for your prescription drug coverage is going to be about $5 to $35 a month. But remember, this is going to vary on your needs. So to summarize, option 2 offers broad coverage of Original Medicare and the added benefit of this prescription drug coverage under Part D. It is a suitable choice for those who need regular medications and prefer that flexibility of Original Medicare. Now let's explore option 3, which combines Original Medicare with your prescription drug coverage and a Medicare supplement plan, also known as Medigap. This choice provides a comprehensive approach to your healthcare coverage. As with the other options, you enroll in Part A, Part B, and Part D. But here's where option 3 stands out. You add on a Medigap policy, which is sold by private insurance companies and regulated by the federal government. These help pay some of the healthcare costs that Original Medicare doesn't cover, like those co-payments, the co-insurance, and the deductibles. The premiums for the Medigap policies are going to range from $50 to $400 a month. The range in premium is wide because of the various levels of coverage. For example, that Plan G is the most popular choice for its comprehensive coverage. Closing out, option 3 offers extensive coverage by combining Original Medicare's comprehensive benefits with the added security of Medigap and the prescription drug coverage of Part D. It's an excellent choice for those seeking peace of mind and predictability in their healthcare expenses. Finally, let's discuss option 4, which is Medicare Advantage, also known as Part C. This option offers an alternative to Original Medicare and is provided by the CMS. Medicare Advantage plans bundle your Part A, your Part B, your Part D prescription drug coverage. This means that you get all of your Medicare coverage in one single plan. The major attraction of Medicare Advantage plans is that they often include the benefits not covered by Original Medicare, such as the dental, the vision, and hearing services. These extra benefits supply significant value depending on your personal health needs. Many Medicare Advantage plans, remember, offer that $0 monthly premium. However, you are going to be subject to the deductibles and co-payments and co-insurances that vary. The plans also have an out-of-pocket maximum, which is going to supply a peace of mind by capping your out-of-pocket expenses. Unlike Original Medicare, Medicare Advantage plans typically have that provider network, meaning that you'll need to use the doctors and hospitals within the plan's contract. And we must check whether your preferred providers are in the contract before enrolling. Now, this choice is well suited for those who value the all-in-one plan, are comfortable with a specific network of providers, and it's also a desirable choice if you're interested in the other benefits that these plans can offer. So you've made your Medicare choice, but what if your needs or preferences change? Let's discuss the flexibility and considerations of changing your Medicare plan. The good news is that Medicare offers an annual election period running from October 15th to December 7th each year. During this time, you can switch between Medicare Advantage and Original Medicare, change Medicare Advantage plans, or add and drop Part D coverage. This period also allows you to adjust your plan based on changes in your healthcare needs and financial situation. Here's a key point to note about Medigap policies. When you first enroll in Medicare Part A and B, you have a Medigap open enrollment period, during which insurance companies can't deny you coverage or charge you more due to pre-existing conditions. However, if you choose Medicare Advantage plans and later decide to switch back to original Medicare with a Medigap policy, you will be subject to medical underwriting. This means your health status could affect your eligibility or cost more when you enroll. So, in conclusion, yes, you can change your mind, but there is that catch. Beware of the rules and the potential implications of making those changes. Now, we have covered a lot of ground, from understanding the distinct parts of Medicare to exploring the diverse options available to you. It's okay if you still have questions or feel uncertain about your choices. That is completely normal. Our goal is to ensure that you feel informed and confident in your healthcare decisions, because each of you has unique healthcare needs and circumstances, and we are here to provide you personalized care. Or we can just simply offer a listening ear to your concerns. As we come to an end of our journey through Medicare, I want to extend a heartfelt thank you for your time and attention today. Navigating Medicare can be complex, but remember, you're not alone in this journey. The Tanna Group is here to support and guide you every step of the way. Please feel free to contact us at thetannagroup.com for any further help. You can visit our website, you can give us a call, or you can even schedule a one-on-one consultation. We're here to help make the best Medicare choices for your lifestyle and health.